Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Martin, your host for today's show. On this monthly show, we bring you information about the agency's programs and services and tips to help you stay safe and healthy at home. Today's program is a bit of an advanced celebration of National Nurses Week, which is celebrated May 6th to the 12th, and it's an opportunity for all of us to give thanks to the many men and women who provide extraordinary care in the nursing profession. National Nurses Week culminates on May 12th, which is the birthday of Florence Nightingale, who is considered to be the founder of modern nursing. Nightingale lived in England from 1820 to 1910, and her legacy lives on through the Nightingale Pledge, which is a pledge taken by nurses before they're admitted to the nursing profession. Similar to the Hippocratic Oath, nurses make a pledge surrounding many ethical issues and to make promises to give the best possible care to their patients. So I've invited 3 nurses with me from Franklin County Home Health Agency today to talk about the nursing profession and particularly how it relates to home health care. So with me are Norma Gainery, Kate Madigan, and Sue Dewey. So thank you each for being here today to talk about nursing. And thank you for the good care that you provide in Franklin County. So let's start right now to talk about what your current role is at Franklin County Home Health Agency and what your position is.
Okay. I am a maternal child health nurse at Franklin County Home Health. Some of the maternal child health services that we offer are home visits to breastfeeding mothers. We offer the Children's Integrated Services Program, which is a comprehensive program offered to mothers who are eligible for Medicaid, and it follows women during their pregnancy, after their pregnancy, and can continue till their child is 5 years old. And we also now have the Nurse Family Partnership at our office, which is a very intensive outcome-based program for first-time pregnant moms. So
yeah, we've done a program on that here.
Yes.
And we'll talk more about that too in the future here because it's a new program. And
that's right.
And
Getting a lot of good reviews
visits as well? Too,
no,
okay.
no. I tend to do the Children's Integrated Services visits and some breastfeeding visits.
Nice. How many people are on your team of nurses?
I do the Children's Integrated Services, and my coworker Mary tends to do the breastfeeding visits, but we can kind of go back and forth. So it's small, and our referrals are lower than usual, and people are not accepting visits as often as usual, but hopefully that'll pick up to what it
Sure.
what
Where
it
would
was.
folks, how do you make referrals
You
to that
can be
program?
referred by your doctor, by the WIC office, by the Family Birthing Center at Northwestern Medical Center. You can self-refer if you want visits. So we get a real variety of referrals.
So if somebody had concerns, they just had a newborn or concerns with breastfeeding stuff, they could even just call and ask what they're eligible for or what their needs are.
Yeah, they wouldn't even have to remember a name. They could just say, I have a new baby, and everyone knows to refer to us.
That's easy enough.
So it's one of 2 people that you'll get. So when I leave a message, I don't tell people to remember a name because especially once you've had a baby, you just had a baby, you don't remember names.
Yeah, that's right.
So I just say, tell them you've had a new baby. They'll take care of you.
To the right place. Great. Well, thank you, Norma. And Kate, tell us about your role at Franklin County Home Health.
So I'm a registered nurse, and Sue and I both work in home care.
Yep.
So we see a variety of patients, mostly post-hospitalization. You need some help, getting back to your normal from the hospital. IV stuff, wound care. We also see hospice patients too. In our age range is a variety too. We have younger to older. So
good. And you're new with the agency, so welcome aboard.
Somewhat
Fairly
new, yeah.
new.
Thank you.
Good.
Thank
and
you.
I'll ask each of you. How long were you there? Have
I've
you been there?
at Home Health almost 6 years now.
Great. Good. And Sue, how about you? How long have you been there, and what's your role?
3.5 years.
Nice.
And I'm an LPN on the home care team. My role is pretty much like Kate says, we see patients in their home. Most often they just left the hospital. We try to keep them from going back to the hospital. One of the things that we do a lot of teaching at home. Sometimes at the hospital there's not a lot of time, or the patient doesn't feel well and doesn't, can't pay attention. So at home, in their own environment, it's a lot easier to do teaching.
And when you say teaching about like their self-care, considering whatever their
diagnosis,
is.
A lot of diabetic teaching, showing them helping them with their machines that they have at home. I mean, the nurse may have shown them at the hospital, but it's not the same machine that they are checking their blood sugar with at home. And you want to make sure they have the right medications that the doctor sent them home with. Sometimes it's a lot different than what the doctor thinks they're on, whether that be financial reasons or they just forgot to pick it up at the pharmacy, or they heard the doctor say the wrong over-the-counter medication, that type of thing.
You're really talking about a team approach there, because you have so many people caring for them at different stages through whatever their condition is at the hospital and on through, so it's good that you can add to that.
Right, it is. There are a lot of people, and sometimes even that is confusing for the patient. I have this question, which doctor do I ask? I've got a doctor for my heart and a doctor for my foot and a doctor, so they sometimes will ask us, who do I talk to about this?
And you can sort of take a look at it all and help them figure out where to do and where to go. Sure. Well, we'll talk a little bit more too about each of those programs. I just want to take a step back for a moment and talk about personally your own experiences and what led you to nursing. If anybody knew since the time they were a child that they wanted to be in nursing, you're nodding your head. Yeah. Can you talk about that?
I was 5.
Yeah.
My brother, my brother had, I don't know if it was chicken pox or the measles or what it was, but he stayed home from school, and my mom had to go to the store and do something, so I took care of him. She said, you stay home and be his nurse. And so I did a good job. He ended up going back to school. I mean, he was fine. Yeah. So, I always wanted to be a nurse. I don't remember a time when I wanted to be anything but a nurse.
That's wonderful.
So,
Yeah. How about you guys?
Yeah, I've always wanted to be a nurse. My mom was a nurse, and my aunts are all nurses, so I kind of come from a family of them. Yeah.
Some good models.
Yeah, I used to go to work with my mom at, she was the supervisor at a nursing home, so I used to go to work with her sometimes at night.
Nice.
Yeah.
It's quite an experience.
So it was nice.
Good. And how about you?
And for me, it's been quite a few years, so I'm trying to remember back. But when I graduated from high school, there weren't a lot of choices. I chose nursing because I really liked the people aspect of it, and that in the end turned out to be what I was strongest in. I was less good with the whole technical stuff and better with the people aspect of it, so I made the right decision, and I'm really pleased about that.
And was it a choice for you later to choose babies in particular, or how did that come about?
The opportunity presented itself to work with mothers and babies, so that's kind of the way I took off. But currently I've taken on some new duties with the as the SASH nurse, which is support and services in the home. So we work with a facility in the area to provide wellness nursing, and it's the average age, I believe, is 80 of the participants. So it's really exciting for me to be back with older people, and again, it's the whole education piece and the whole people piece, so I'm loving it.
Good. Well, that's good to hear. We want to keep you there loving it. What about your backgrounds? Did you work in other types of facilities before you came to home care, and then talk about what brought you to home care in particular? How about you, Kate?
Well, I used to work in Connecticut in long-term care, and then I worked in Burlington in subacute rehab for a few years.
Okay.
In home care, I came to home care. I kind of like the community setting of it. I always kind of like doing the admissions and the discharges and seeing the improvement. So that's kind of why I came to home care.
So when you say doing the admissions and the discharges, a specific nurse takes on that role?
Yep, so you would admit a patient who is not doing the greatest or not feeling well, but then through teaching and your services, you get to discharge them back to good health.
So you see that result.
And we see that a lot in home care, so it's nice.
Yeah, nice. Yeah. Have you always worked in home care, Sue?
No. I've worked in the hospital. I worked on an orthopedic floor in Connecticut, actually. I worked on a med-surg floor. I worked in a doctor's office in Swanton. And for 17 years, I worked at pediatric office.
Okay.
I left there to come to home care, and that was a big change. But that's one of the nice things about being a nurse is, you can tell people I'm a nurse, but you've got ER nurses and you've got pediatric nurses and you've got there's so many things that you can do.
Everything you just listed there was a
Yeah.
huge background of
and
learn
there's-
new things, and
There's a lot more than that as well, and it's just so you never you have a lot of opportunity to do different things.
yeah, very nice.
Yeah.
Can you talk about the requirements as you're to maintain your nursing license? What do you need to do for that?
You need continuing education through work.
Okay.
They offer classes and that kind of thing.
Yeah.
CPR obviously.
Yep.
Keep up to date on all the new kind
Yeah,
of ways to
yeah,
do things. and-
absolutely.
You have to work a minimum amount of hours per year
Yep.
to maintain it.
Okay.
Yeah.
Right.
And go ahead.
And that is one nice thing about home health is they do encourage you to do continuing education. I've gone to a couple of conferences in Burlington, one on wound care, one on diabetes. We have skills day where we get together and talk about, and it's just within the nurses that we have here. We talk about different skills that we do. We had one session on diabetes, and the nutritionalist was there talking, and just talking about different things. I mean, diabetes has changed a lot. The treatment for diabetes has changed. We have monitoring, which is where we can check a patient's blood pressure, pulse, weight, and oxygen saturation in their home, and that electronically comes back to the office. And we had a little in-service on how to do that, how to set it up.
Technology,
Yeah,
for sure.
yeah. But that's kind of nice for patients who
Yeah.
need to watch their blood pressure or need to check.
So in the
different
past, before we had that, a nurse was required to go and do these things for
Daily,
them. So
yes.
this
Right.
helps because for time and efficiency, and also gives a little more, I imagine, for the patient to learn how to take care of themselves, learn those vital signs and whatnot.
things. Right.
Yeah, good.
It's also convenient for the client, I would think,
Yeah.
because sometimes some of our patients or clients have like 10 million appointments. So even though we're going into their home, even
the only
that's
thing
just
going
one
on.
extra thing. So if they can do it a little more on their own terms,
Yeah.
I would imagine that they would really appreciate the
Yeah.
telemed service too.
Yeah, for sure. Now, how many patients do you have, on average yourself? Is it?
Daily?
You're assigned your own cases though, right? So your patients do, for the
Yeah,
most
but-
part, get to know you.
Right, but we do help each other out and share. I mean, we'll share with another nurse, a patient, and that kind of thing.
Yeah.
Because we do have days off once in a while.
Yeah.
Sometimes.
Nurses do take care of themselves.
6 patients a day
Yes.
is because we do a lot of traveling.
Yeah. Oh, yeah.
Sometimes it takes
Yes.
25 minutes to get to a patient's home, so that means that it's 25 minutes to get
Yeah.
back. So
Yeah.
we do a lot of traveling, but my manager likes it if I see about 6 patients
Sure.
a day.
Yep.
So
But you really, with that, you're able to build that one-on-one, nice
yeah.
personal
Yeah.
relationship with each of your patients.
I get a little protective over some of my patients. Some of the other nurses might
Yeah.
tell you that some you get to know. What times work best for them, and you just get to know them a little bit, and you're in their home. You're really it gets kind of
Yeah, it's a new dynamic because it is their home, and
Right.
and that's what we want to. That's our mission, to strive for that they be comfortable in their own
Right.
home. So
Right.
you give the care that they need.
Right.
Sure. Since we're talking about schedules and things, talk about your team approach with other care providers at the agency who you might work with.
I work
Outside
closely.
nursing.
I work closely with our medical social worker, because some of the families that I see have needs beyond nursing, beyond parenting education, beyond having their baby weighed, beyond breastfeeding support. They may be having issues with money for food or transportation to doctor's appointments or mental health issues. So often I'm able to bring Tracy into the family, and she works a lot. She's very familiar with resources and is also very skilled in counseling, so she's a big help to me.
Nice.
I love it when I get to work with her.
Good. That's nice. And how about you guys as nurses?
We use social work quite a bit. You know, therapy-wise, we use physical therapy, occupational therapy, sometimes speech therapy too. In the community, we use NCSS sometimes, CVAA, the Office for Advanced Aging.
Yeah.
We have a nutritionalist who will go into the home, and that is very helpful with the newly diagnosed diabetic patients and some of the patients who've been diabetic for years. So, you know, teaching them how to recognize different foods, how to read labels, that type of thing, and for her to actually go in the home and look in the cupboard and show the patient there is nice. And you know, the nurses, we do work well as a team. Kind of, you know, some patients are seen 3-4 times a week, so one nurse can't do that all the time. Some patients are seen on the weekends, so it's a different nurse on the weekend. So we do.
And they also receive a lot of them nursing assistants as well.
Yes. Yes.
In conjunction with what you're doing.
That's right. Nursing assistants and the care attendants. Who go in and help with, you know, household stuff, meals, that type of thing.
Yeah, it was a really collaborative within the agency and within the community, like you mentioned, Kate. So it's good teamwork there. Thank you. Talk about, if you would, you mentioned hospice, that you and Kate work in the hospice program. Can you talk briefly about the program itself and how hospice nursing is different?
Okay. Hospice, and I think a lot of people in the community don't really know the difference between hospice and palliative care. But I'll talk quick about palliative. Someone who's on palliative care can have a diagnosis of cancer or you know, a number of other diagnoses. We always just kind of say cancer, but they seek treatment, you know, hoping that they might get better, but they still are quite often end stage, meaning they're close to dying. Hospice is when they've tried all the treatments, and sometimes the treatment can be worse than the cancer